Hello and welcome to the Better Business Bureau Open Enrollment presentation. This presentation will cover the plan year beginning October 1st of 2023 through September of 2024. Anse & Associates is very happy to partner with the Better Business Bureau of Wisconsin and looking forward to presenting the upcoming plan information. So welcome to open enrollment. We encourage you to take a moment and evaluate the plans that you are currently enrolled in and whether or not you would like to make any changes. Make sure to note that any election changes that you do make during this open enrollment period will become effective on October 1st. And one other note to make is that even if you are choosing to continue on the plans you currently have in place, you will need to submit those elections during this open enrollment process. So even if you aren't making changes, you will need to participate in this open enrollment process. So first and foremost, who is eligible? For most of you on the plan, you're very familiar with this, but as a reminder, all full-time employees are those working 30 or more hours consistently per week, and of course would be eligible to elect any of the benefit plans described in this presentation, including any of your eligible dependents as well. So before we dig into the plans for the upcoming year and how to make those elections, really important to note which benefits you are currently enrolled in and how they are serving you. So again, make sure to evaluate where things are at. If you're happy with the plans you have, you can continue to participate in them. But if you do need to make changes, now is the time to do so. So make sure that any of your contact or personal information is relevant as well. And make note of any dependents, beneficiaries that need to be listed on those plans. Outside of this open enrollment period, you will not be able to make changes unless you do have a qualifying life event. For example, a marriage, divorce, loss of coverage elsewhere, birth of a newborn child. Outside of any of those qualifying events, the plans that you elect during this time will remain in effect through the plan year, which will bring us into September of 2024. So as a reminder, open enrollment will be running from September 11th through Friday, September 22nd. Again, whether or not you are making changes, you will need to go through this open enrollment process and make those elections for the plan year beginning on. The annual health plan review process, I'm sure that many of you are aware of the increasing importance of really evaluating health plan performance and making sure that the plans that you are enrolled in are best serving you. The increasing cost of healthcare is certainly not something that's going away. And so the Better Business Bureau of Wisconsin and Anse & Associates take a very close look at how your plans are operating to make sure that not only are the options serving you, the employee population, well, but we are also doing everything we can to contain those costs and out-of-pocket expenses. So very happy to note that your dental and vision plans will not only remain consistent, so there will not be a plan change in carriers nor in plan design. Everything is remaining the same on those dental and vision plans, as well as your medical plans. So all plans will remain with United Healthcare. There's no change in network, in covered providers, or in the plan designs. The dental and vision plans will also remain at the cost they are now. You will not be incurring any increase in those plan premiums. The medical plan has increased very slightly. However, the Better Business Bureau is taking the bulk of that increase so that you, the employees, are not incurring a major increase to your payroll deductions. And one other quick benefit update to note, we'll certainly cover this in a few slides, but the short-term disability benefit amount, weekly benefit amount, is increasing. So that maximum will go up to $1,000 per week versus the $500 that it's at now. So moving into your medical and prescription drug plan, again, this plan is going to remain with United Healthcare. There's not going to be a change to the plan design nor to the network of covered providers. So for those of you currently on the plan, you're not going to experience any disruption. The annual deductibles will remain as they are now, as will the coinsurance. So you're again going to experience that 80-20 split on any coverages. Your preventive care visits will be a $0 copay, and specialist visits will be a $100 copay. Do make note to review the provider list. You want to make sure that you are seeking care in network whenever possible, because as you can see, out of network, you're not going to have coverage. So outside of those emergency room visits, you're going to want to make sure that you are visiting an in-network provider. And myuhc.com does have all of that information. So certainly something that we'll cover again in just a moment. So on that note of maximizing your benefits, again, utilize those in-network providers whenever possible, because that is going to make a big impact on your out-of-pocket expenses. You can visit myuhc.com to see not only a complete list of services in terms of your plan design and how that coverage works, but you'll also see provider maps, network maps. You can search pharmacies. There's a number of different features in myuhc.com, in addition to providing you those plan summaries and, of course, a digital copy of your ID card. So really important that you take a look. If you haven't registered on myuhc.com, certainly do that. A couple of other benefits more so related to prescription drugs is the mail order pharmacy benefit. This is something that, again, for those of you who may have pharmacy needs, it's a great option to take a look at. The mail order pharmacy benefit essentially will provide you with a delivery of a bulk supply of that prescription drug. For example, receiving a 3-month supply of a certain drug at the cost of a 2-month supply. So there typically is a significant cost savings in using that mail order pharmacy benefit. And then, of course, using generic medications whenever possible is going to help in cost containment. So do make sure that you're asking your providers or your pharmacists if there are generic options available of those medications. Lastly, Rally Rewards is a built-in wellness incentive program that United Healthcare offers. Again, for those of you who may not be familiar with UHC or have not explored myuhc.com, definitely get registered and take a look. Rally Rewards is something that you'll see again on myuhc.com, and you can register for this program. What it does is helps you to earn points on anything related to wellness initiatives. So, participating in those annual preventive care screenings, getting outside and getting some exercise, focusing on your nutrition, all of these different activities can earn you Rally Rewards, and those Rally Rewards translate into cash incentives. So you are eligible, as you build those rewards or points, you are eligible for cash incentives that are mailed via check to your home address. So it's not something that you're submitting a reimbursement for, nor is it running through your employer. This is something that you log online, and as you're logging those points, those incentives for building. And I believe the maximum for the year is a $300 cash incentive. So again, definitely worth your while to check out that Rally Rewards program as well. Dental benefits, again, there will not be any change to your plan design. This plan will remain with United Healthcare in the upcoming plan year. So your preventive services will continue to be covered at 100%. Those annual deductibles will remain at the levels they are currently. And then again, basic services will be covered at 90% after your deductible has been met. So really no change to this plan design, nor any changes to the payroll deductions that you can expect. Same goes for the vision benefits. You will continue to have that coverage through United Healthcare. Again, no change to the plan design. So in-network and out-of-network will be covered as they are now, with the copays that you see listed here. And the payroll deductions will remain as they are currently. So your disability Income benefits have slightly changed. The Better Business Bureau will now provide a maximum weekly wage replacement of up to 1,000 per week. Currently, it's at 500, so it is increasing to 1,000 per week. But again, this benefit is available should you be rendered incapable of working for a short or long period of time due to an accident or illness. So as you can see here, the benefits begin at different stages depending on the situation, and then payable to replace income at 60% of your regular wages. So definitely a great benefit. And this is, again, something that the Better Business Bureau covers the 100% of the premium cost. So this is not something that you pay for, but it is a benefit that you as a full-time employee are eligible to receive. The same goes for your basic term and death and dismemberment insurance. This is a plan that the Better Business Bureau provides to all full-time employees. And this is not something that you pay for through payroll deductions. This is 100% covered by the Better Business Bureau. So the benefit amount is equal to 1 times your annual salary with a maximum benefit amount of $100,000. So do make sure that you have an updated beneficiary on file. If you don't, please contact Human Resources to make sure that you do have the most relevant information on file. The voluntary life insurance is something that you are eligible to participate in if you choose to supplement that basic group life policy that the Better Business Bureau provides for you. This is something that you can also elect to cover spouses or dependent children as well. So as you can see on this rate chart here, this is the cost that you could expect to contribute towards that voluntary plan. And then minimum coverage is a benefit amount of $10,000 and a maximum of $300,000. So great benefit option available here if you don't have something in place. In addition to that voluntary life plan, you also have the opportunity to contribute tax-free dollars towards either or both a healthcare flexible spending account or a dependent care flexible spending account. And essentially, major tax savings here. So these are pre-tax dollars that are going towards these accounts and then can be used to essentially reimburse yourself for those eligible medical expenses that you may be paying out of pocket. And again, you do need to re-enroll in this plan. So if you are currently using a flexible spending account, you will need to, again, re-enroll and make sure that you have appropriately listed the amount that you're looking to contribute. As a reminder, for those who may not be familiar with these types of accounts, there is an annual limit to the amount that you can contribute because, again, there are tax savings involved. So the limit in 2024, so the upcoming calendar year, it will increase for an individual up to $3,200 that can be saved towards that flexible spending account. And again, this is used as a reimbursement. So you will have that full amount depending on what you choose to contribute. You'll have that full amount available for those eligible expenses. So think of things like if you are visiting your eye doctor, you get a new pair of glasses and you have to pay $50 towards your frames. That would be an eligible expense that you could reimburse yourself with this FSA account. So definitely worth taking a look at in terms of some tax savings. Dependent care FSA, again, is just as it sounds. So same concept, you are electing to contribute towards this account in tax deferred dollars and then reimbursing yourself towards the cost of child or adult dependent care. You have a voluntary critical illness and accident insurance benefit or plan available to you as well. And both of these plans are available for spouses and dependents as well. So um, in terms of how these plans work, they are, again, voluntary plans. So you as the employee are responsible for 100% of the premium cost. And they provide a cash incentive benefit should you incur a critical illness or an accident. So these plans do not have to be elected together. You could certainly elect either or independently of one another. The critical illness is just as it sounds. Should you or a covered dependent experience a critical illness, such as perhaps a cancer diagnosis or a heart attack or stroke, this insurance plan will provide you with a cash benefit based on the situation or the diagnosis. So these funds can be used not only towards out-of-pocket medical expenses for care, but they can also be used for relevant expenses related to that condition. So, for example, if you are having to travel to receive care, or perhaps having to stay overnight in a hotel, these funds could be used towards those expenses as well. The accident insurance plan is available in the event of an accident or injury. So for those of you who may have dependent children, very active in sports, and perhaps more prone to accidents or injuries, this is a great benefit to take a look at. And again, this will provide you with that cash benefit based on the injury. So, for example, a broken arm, you may receive, a cash payment of perhaps $400, based on that particular injury. So these are reimbursable cash benefit and incentives. So next steps in terms of open enrollment, you will have until Friday, September 22nd to make your elections online. So this is something that, again, all eligible employees will need to submit. So whether you are waiving, changing, or keeping your current plans, you will need to go through this process. Again, a couple quick reminders on United Healthcare. If you have not registered, please do so. You're able to search providers, pharmacies, prescription drug lists. You can set up those rally rewards for cash incentives. And there are some, in terms of prescription drug lists, there are both some low cost and zero cost share preventive medications listed on myuhc.com. So if you are someone who is using prescription medication, that is a great resource to take a look at, and again, minimize the expenses. If you do have any questions related to the benefit plans available to you or how to make your elections, please defer those to Sheila in Human Resources. And thank you so much for your time. Anthony and Associates is happy to work with your team, and wishing you all a very happy open enrollment 2023.